So this video is going to be talking about my patient who was just recently diagnosed with type 2 diabetes, and they're going to be starting metformin, so I'm going to educate them on their medication, some lifestyle modifications, and things like that. Okay, so I'd walk into the patient's room, perform hand hygiene, and introduce myself. So I'd say, hi, Michelle. Hi, my name is Michelle. I'm going to be your nurse today. And today we're going to talk about your recent diagnosis of type 2 diabetes. And we're going to go through your medication, some things that you should know about your diet, how to test your blood sugar, and just some things to look out for. Okay, so with type 2 diabetes, you have an insulin resistance, so that means that you're still producing insulin, but you're not producing enough that would compensate for your blood sugar levels. So your blood sugar levels are normal. Normally anywhere between 60 to 100 if you're fasting. So it looks like your blood glucose is higher than normal, and you've gone through some testing for that. So because of that, you're going to be started on metformin, which is a tablet drug, and we'll talk about that a little bit later. But with type 2 diabetes, you want to take your medication and look out for any complications. Just so that your blood sugar stays under control. So the best way to prevent some complications, whether that's having too high of a blood sugar or even too low of a blood sugar, is to always monitor your blood sugar, and to never skip a meal or skip a dose of your medication with the meal. You always want to take it as prescribed by a provider. And you want to always monitor your blood glucose. You'll be given a blood glucose monitoring machine. And how you work that is, you would always want to wash your hands before you use it, and insert the strip into your machine. And then you will use the lancing device on the outside of your finger. It doesn't matter which finger, but you would use the outside of it. You would prick it with it, get a drop of blood, and then you would hold it to the testing strip that's inserted into your device already. And this will read the result, and it'll tell you what your blood sugar is. So I'll be giving you some handouts and stuff, but just some numbers right now. Your fasting glucose should be anywhere between 60 and 100. If you've just eaten a meal, it could be a little bit higher, 72 to 99. And if you take it, say, like 2 hours after you've already had a meal, that's when it'll pretty much be its highest, around 140. So with meals, because your metformin is taken with your meals, you really want to try and stick to a meal schedule. And I recommended a nutritionist for you. She's coming to see you, and she can talk about some foods to avoid, some foods that are really great for you. And just to stick to sort of like a schedule of when to eat, so that you don't forget to skip a meal and you don't forget to take a dose as well. If you want to add in some exercise is always great, no matter what diagnosis you have or if you don't have one at all. Even if that's just taking a walk after dinner or on your lunch break, incorporating any type of exercise is great for the body, especially when you have something like diabetes. Some signs and symptoms of hypoglycemia. Hypoglycemia is when your blood sugar drops too low, and that's not something that you would want. Even though your blood sugar is really high, you just want to always keep it in that normal range. So if it's too low, you might feel some heart palpitations, you might be sweating a lot, some irritability or anxiety, you might be a little shaky, or have some confusion. And with this, if you ever feeling any of these symptoms, and you're unable to get a reading, like if you're out or something, just have like a half a cup or 4 ounces of orange juice or like a fruit juice. If you have any snacks, some good snacks could be yogurt, or if you want to grab a or if you just missed a meal, it's good to get that meal in then, or something that's high protein. So those are just some signs and symptoms to look out for. It'd be great if you will if you told your friends and family about your diagnosis, which is totally up to you, but having, your friends and your family know about it, those signs and symptoms to look out for as well. If God forbid you were to go unconscious, or if something were to happen in a severe case, severe scenario, it would be good so that they know that what you have, what you're taking, ways to help you, or when they call for help, to let them know what you have. And some signs where your sugar is really high, which you could also test from your reading with your blood glucose monitors. If you have the increased urination, increased thirst, increased hunger, if you have any blurred vision, or if you have some headaches. So now we're going to talk about your medication. So your medication is metformin, and it comes in a tablet form. It's an extended release tablet, so that means that you cannot crush it, you cannot chew it, and you cannot break it apart or put it in anything. You have to just swallow the tablet whole with the drink. And you are going to take it with meals, and you want to take it with meals also just because it'll prevent any belly aches or GI upset. So it's tolerated best when you take it with food. And some side effects of this medication could be heartburn, or an upset stomach, like we just said, nausea and vomiting, or some gas. So if you have any questions, you could always reach out to your provider. I'm going to give you some pamphlets and stuff. Again, if you want to even bring in your family members or some friends that you're really close with, we can also go over all of these things with someone else so that it's more helpful for them to understand what's happening. So just feel free to reach out for us.